Working for Lifeline can make a difference in people's lives. It's important to identify risk of stroke and cardiovascular disease so people can proactively do something about it.
Through Lifeline screening, you either get peace of mind or early detection. Both are a good thing.
For most people who have a stroke, the first warning sign is the actual stroke, which can be scary. Lifeline screening examines people who are asymptomatic, so if an abnormal finding is identified, there is still time to make a prevention plan with your doctor.
If you have plaque in your arteries, it's likely to worsen as you get older, so it's important to get screened regularly.
We at Lifeline Screening have screened over 9 million people over 25 years. We identify your risk of stroke, cardiovascular disease, and other chronic illnesses. We use state-of-the-art ultrasound technology to look into your arteries to identify your plaque levels. During your screening, we examine the carotid arteries in the neck for plaque buildup that can lead to a stroke. We check your abdominal aorta for an aneurysm, a ballooning of this large artery in your belly which can rupture if it gets too big. We evaluate the pressures in your arms and ankles and calculate what is called an ankle brachial index. This is an indirect way to assess the flow in the arteries of legs and identify risks for more cardiovascular disease. We scan your shin bone to determine the density of the bone and derive risk for osteoporosis. And lastly, atrial fibrillation, the most common type of heart rhythm problem and a risk factor for stroke. If we detect anything that requires urgent attention, we will notify you immediately so you can contact your physician for follow-up. Screenings are simple, non-invasive, painless, and we have convenient locations throughout the United States. And of course, screenings provide peace of mind or early detection. Schedule your screening today.